Do you remember those first few weeks when the streets were dead silent, hospitals were overflowing, and a weird feeling floated around that the world might not bounce back? COVID didn't just make people sick, it cracked the whole system. Everything froze. And honestly, for a while, it began to feel as if there was no way out. But then came the vaccine. Fast. Almost too fast. So, how did we pull that off, and why did some people fight so hard against it? Let's get into it. Imagine how isolating the quarantine periods were and keeping a distance from those around you. And for the first time in a long time, the world collectively felt POW. What COVID felt like, you probably remember where you were when you first heard about it. Something about a mysterious virus, a wet market, and something about bats. It didn't really seem real at first, just one of those distant headlines that you scroll past while sipping your coffee. But then the cases started popping up all around Italy, America, the UK. Suddenly, it wasn't over there. It was everywhere. And within weeks, the world completely changed. Borders were slammed shut. Flights got canceled overnight. Schools closed down and offices emptied. The idea of normal that we had created over the decades completely changed. From handshakes to crowded buses and crowded markets, all of it disappeared. We were told to stay home, stay away from each other, disinfect our groceries, and just wait. And that's what made COVID so terrifying. Not just the virus itself, but the stillness, the weird, unnatural stillness of living a life that felt paused. Think about it. The cities that were once loud and chaotic became silent. It was like someone had pulled the plug on the planet. And as the weeks stretched into months, a new reality set in. This wasn't going to be over quickly. Hospitals all around the globe started filling up while funeral homes couldn't keep up. And the healthcare staff was burning out, begging people to take the virus seriously. Every day brought new numbers of cases, deaths, and hospitalizations. By early 2025, over 7 million deaths were directly confirmed worldwide, with more than 1 million in the US alone. And those are only the official figures. When researchers factor in excess mortality, the people who died directly or indirectly from COVID, the death toll may have reached between 19 and 36 million. And then there was the mental health collapse. The quiet pandemic behind the pandemic. Anxiety, depression, and burnout became constant mental states. Even people who weren't sick were struggling. We also saw the ugly side of panic. Misinformation was everywhere. People bought up all the toilet paper and hand sanitizer. Others said the virus was a hoax, even as it killed their neighbors. Some countries even hoarded vaccines, PPE, and ventilators, while others couldn't even get basic testing. So, the rich countries locked down and the poorer ones suffered in silence. The pandemic exposed every crack in our systems: economic, racial, political, and medical. Meanwhile, science was scrambling, so labs and scientists around the world were working non-stop to find a cure. The need to understand the virus, to figure out how to build treatments, and to design a vaccine was crucial for survival. So, COVID didn't just kill people. It messed with our heads and completely upended our routines. It changed the way we saw each other and made us hyper-aware of breath, of touch, of space. It made everyone a potential threat, and everyone vulnerable. Which is why when the news of a vaccine made headlines, it brought back the hope everyone desperately needed. But before we get there, let's back up. What is a vaccine really? How did it cure the world of a pandemic that felt like the end was near? How vaccines work? Let's be honest, most of us didn't really think much about vaccines before COVID hit. You'd get a shot as a kid, maybe one before travel, and that was that. However, during the pandemic, everyone was suddenly talking about antibodies, immunity, and booster shots like it was everyday stuff. So, now comes the question, what does a vaccine actually do? To break it down in simpler words, a vaccine readies your body for a fight. It essentially shows your body what the potential threat the virus looks like. Why? So that when that threat enters the body, your body's immune system can recognize and fight it immediately. And no, it doesn't make you sick, but it trains your body to defend itself. Think of it as showing a security guard a photo of someone on a watch list. So, at its core, it prepares your immune system. Now, there are different types of vaccines. Some use a weakened or dormant version of a virus to inject into your body, as your immune system can quickly deal with a weaker version while noting down the virus's properties for future instances. And some use just a part of it. And newer ones like the COVID-19 vaccine use genetic instructions which basically tell your cells to temporarily build a harmless version of the virus's spike protein. That's the bit of the virus your immune system needs to recognize because these proteins help the virus enter the body's cells by allowing it to attach to and merge with the cell's outer layer. Once your body sees that spike protein, it basically says, "Oh, this is trouble. Let's learn how to take it down." It starts making antibodies that neutralize invaders and activate T cells, which are responsible for finishing off the infected cells. And the coolest part, your immune system will always remember the virus. So, even if months or years later you're exposed to the real virus, your immune system doesn't have to start from scratch. It stays ready. Now, enter mRNA, the game changer. When it comes to COVID-19, the vaccines developed by Pfizer, BioNTech, and Moderna are based on a brilliant, revolutionary concept, which is mRNA. Instead of injecting a piece of the virus, they inject the blueprint, the messenger RNA, that tells your cells, hey, build this harmless piece of the virus, specifically the spike protein. Your cells comply, build that spike, then chew up the mRNA. Meanwhile, your immune system sees the spike and says, "Noted, this is who's forbidden here," and kicks into gear. This sets up a perfect memory response without you ever actually catching COVID-19. This whole mRNA vaccine idea didn't come from nowhere. Scientists have been working with mRNA since the 1960s, constantly overcoming hurdles around delivery and stability. But breakthroughs in the 2000s made this possible for human use. By 2010, Moderna and BioNTech were founded, fueled in part by strategic investments like those from DARPA. But how did a vaccine go from genetic code to shot in arms in under a year? That's unprecedented. When the genetic sequence of SARS-CoV-2 was shared in early 2020, scientists jumped into action. Companies like BioNTech started Project Lightspeed immediately, partnering with Pfizer worldwide just days later. And the US, too, poured massive funding into this race, like the Operation Warp Speed alone injected around $10 billion into vaccine development and production infrastructure. Even the regulatory process was reimagined. Instead of waiting for each trial phase to finish before starting the next, trial phases overlapped. And the manufacturing capacity was built even before approvals were granted in order to maximize speed without skipping safety checks. Within months, human trials were underway. By November 2020, Pfizer-BioNTech announced roughly 95% efficacy, and emergency use approvals followed quickly in December 2020 in the US, UK, and EU. Less than a year from pandemic to immunization rollout, an unprecedented scientific sprint. And it worked. And the thing is that the speed wasn't as reckless as it seems. Think about it. Decades of foundational research, huge financial support, and global collaboration all converged into that moment. It showed not only what we can do when there's collective will, but why this technological leap could change medicine forever. But it's never as simple as it seems. When the COVID vaccines hit the scene, they were game changers, but definitely not without controversy. Instead of understanding and applauding the quick development of the vaccines, many were averse to it. The quick development triggered an alarm that it was too fast to be safe. And the broken trust in institutions and the spread of rumors prior to the vaccine all pushed forward this narrative. Globally, what started as caution became barriers. In places like Qatar, safety concerns and a rush for self-research fueled doubt. And in South Asia, suspicion of Western medicine, collective distrust, and educational divide greatly increased vaccine resistance. Also, another shocking statistic, the WHO estimates that each year, around 1.5 million children die from illnesses that we already have vaccines for, despite having the means to prevent them. Vaccine hesitancy remains one of global health's biggest threats, and it's not just new. History has a track record. Here's where it gets wild. The anti-vaccine sentiment isn't a COVID-era thing. It goes back centuries, all the way back to Victorian England when the government made smallpox vaccination mandatory for infants in around the mid-1800s. And oh, did it spark controversy and fierce opposition. The people rallied, demanding rights over their bodies. The Anti-Compulsory Vaccination League formed, and by 1885, tens of thousands marched in Leicester with banners, even a coffin and effigy of Edward Jenner, the creator of the first vaccine. Eventually, England added a conscience clause around 1898 that let parents opt out, and that helped diffuse the movement. And that's not the only time in history. There has always been resistance. Even in Rio de Janeiro in 1904, a law that mandated smallpox vaccination triggered major riots. The whole opposition movement was named the Vaccine Revolt. Imagine trams overturned, hundreds injured, and dozens killed. With such aftermath, the authorities eventually had to roll back the mandate. Fast forward to today, and even with mRNA's success in saving probably tens of millions of lives, skepticism remains. Take the decision by the U.S. Health Secretary Robert F. Kennedy Jr. to scrap $500 million in mRNA research funding. He claimed mRNA isn't effective enough for respiratory diseases, but leading scientists warned the move undermines pandemic preparedness, pointing to real data showing mRNA vaccines prevented massive loss of life. So, what does this teach us? The truth is, today's vaccine debates aren't exactly new. Today's vaccine hesitancy echoes these old fears that have been seen through the centuries. We've been through this before, just in different forms and times. And if there's one thing history's been trying to tell us, it's that shaming people into agreement won't do anything. However, helping and asking the right questions will. There needs to be trust. And by understanding the science, that can happen. Simply by basing opinions on facts and not fear. We don't need blind trust. We just need informed trust. Thanks for watching. We hope this helped you understand how vaccines work on a deeper level. But hey, if you have any questions, let us know in the comments below. And don't forget to subscribe and share.